Our group's movement was the volleyball approach, which is shown here. The purpose of the volleyball attack is to place the ball in the opponent's court, so it is difficult for them to return it. The approach is used for three things, mainly to create momentum for the attack, to establish movement towards the ball after the setter sets it, and finally to utilize the vertical jump for trajectory on the ball. There are going to be two main phases, the approach and the vertical jump, that we will break into 7 little steps.
The first step in the volleyball approach is simply stepping forward with the left foot. As you can see here, Chelsea is in the act of that with her left foot forward. We'll go over the different body movements right now. The left hip is flexed along with the left knee. The left ankle is in dorsiflexion. On the right side, we have the right hip is extended along with the right knee, and the right ankle is in plantar flexion. Both the shoulder and elbow joints are also flexed, and then the neck is extended looking for the ball, and then the abs are isometrically contracting. This all happens in the sagittal plane with a frontal axis.
So in the second phase, Chelsea is planting her left foot down and bringing her right leg through. The left hip slowly extends while the left knee joint extends as well, and in your left ankle joint dorsiflexes. After that, while the right leg flexes and the right knee flexes, the right and left elbows are extending, and both the shoulders are extending as well.
Okay, during the third phase of the movement, the shoulders and the arms are swung back by extending the shoulder joint and extending the elbows. And at the same time, the left hip is extending as well as the left knee. And the left ankle joint is in plantar flexion while the other is slightly dorsiflexed on the right side. And also on the right side, the hip joint is flexed as well as the knee joint, shown right here.
The fourth phase of our movement happens by planting of the right foot and bringing the left leg through. As you can see here, this is caused by extension of the right hip and right knee with dorsiflexion of the right ankle. The left hip and knee are flexed, and the left ankle is in plantar flexion. The arms are still the same. They're both extended back behind you. And yeah.
So the fifth phase is taking your left foot as slightly planted ahead of your right foot, and the left hip joint extends while the left knee extends and the left ankle joint dorsiflexes. Both of her arms are swinging forward by flexing the shoulder joints with extended elbows.
The sixth phase of the motion is when the player goes airborne. In this picture, the person is able to jump by extending their hip joints and their knee joints and then plantar flexing both ankle joints. The arms are continuing to swing through to generate that momentum for the swing of the approach.
The seventh phase is she is in the air. She is getting ready to swing her arm. All muscles involved are isometric contraction.
Now we will be talking about the muscles involved with the movements. So we'll start with hip flexion, and this is happening by the concentric contraction of the iliopsoas, which is right here. And then the rectus femoris, which is cut right here. The sartorius, which is the band going across here. The pectineus, which is right here. And the tensor fascial latae, which is right here. Hip extension happens by the concentric contraction of the gluteus maximus, which is cut right here. It's your butt muscle and your hamstrings. And then it also involves the eccentric contraction of the adductor magnus, which is right here.
So knee flexion happens in the hamstring, and it's concentric contraction of the hamstring and an eccentric of the sartorius and the gracilis. Sorry, and then it's also extension of the quads right here.
Ankle dorsiflexion is caused by the concentric contraction of the tibialis anterior, the extensor hallucis longus, which is here, the extensor digitorum longus, which is there, and the peroneus teratus, which is not shown in this. Plantar flexion is caused by the concentric contraction of the peroneus longus, the gastroc, and the soleus.
Okay, elbow flexion occurs through the concentric contraction of the biceps brachii, the brachialis, which isn't shown on this diagram, and the brachioradialis, which is right here. Elbow extension occurs through the concentric contraction of the triceps brachii and the anconeus, which is right here.
So in shoulder flexion, we have concentric contraction of the pectoralis major, the bicep brachii, which is here, and the anterior deltoid along here. For extension, we have concentric contraction of the lats, teres major, which is here, and minor, which is there, and the infraspinatus, which is right there. The eccentric contraction of the subscapularis, which is not shown, and the lower fibers of the pec major, right along there. Some safety concerns due to mechanical errors include not having the correct timing of the approach, incorrect footwork, along with that some injuries that happen to the lower extremity and the shoulder are possibly jumper's knee, which is injury to the patellar tendon, ankle sprain from improper technique, and overuse of the shoulder when attacking. Good. And that concludes our analysis of the volleyball approach.